Hi, I'm Robert Demetrio, board certified urologist, here to talk to you about the vasectomy procedure. The vasectomy is most commonly done procedure for male birth control. We typically do them in our office and it takes approximately 15 minutes. Patient comes into the procedure room, we have them get undressed, and once we prep the area and put our sterile drapes on, the first move is to identify where the right vas deferens is down in the scrotum, and I'll give the patient a warning count to 3, and once we do the warning count, there's a pinch and a burn, and that's our local anesthetic going in, and that numbs up the right side of the vas deferens pretty much instantaneously. And then I usually will go to the other side and then warn the patient and then do another injection on the left side to numb that. Once we have everything nice and numbed up, I make my entry point down the middle of the scrotum where that line is called the scrotal raphe, make a tiny little opening in the skin, and then I grab the vas deferens on one side, elevate it up through the incision, and get it dissected away from the surrounding blood vessels and the sheath. And then I put a permanent silk tie, 2 of them, and then cut the piece in between the ties that will be sent out for the pathologist. I usually will then cauterize the ends, and then I will take another type of suture and fold one end of the vas deferens back on itself so that it makes it harder for the 2 ends to reach each other again. And once that's done, I let that vas deferens drop back into the scrotum where it belongs, and then we do the exact same thing on the other side. The skin is then closed with one little dissolving stitch. We cleanse the area, put a dressing on there of gauze, a little bit of antibiotic ointment, and then we let the patient get dressed and then head on his way. Typically, we'll give the patient a small dose of acetaminophen if there's no issue with taking that medication. And then at home, we have the patient stay off their feet for the rest of the day as much as possible and keep an ice pack or a bag of frozen peas or corn or whatever the patient has in the freezer at home right over the top of the scrotum to keep things cold and to try to reduce the swelling and discomfort as much as possible. At home, we have the patient alternate taking acetaminophen and ibuprofen every 3 hours, alternating one then the other. Works best if you do that around the clock. Take a small dose of each every 3 hours without waiting for the pain to come. Works like a charm. We've not had to prescribe narcotics for at least 5 years for this procedure since we started following that program. The main things to look out for, obviously, are swelling and bruising. The swelling and bruising is usually minimal. If there's a significant amount of bruising, I tell the patients if their scrotum looks like a big purple eggplant, they should notify us about that right away. We usually will have the patient avoid very strenuous physical activity for the next several days. The majority of these we do on a Thursday or a Friday in the office to give the patient time to recover. And then by Monday, the vast majority of the patients are pretty much doing what they want. I tell them to avoid sexual activity for 1 week, and they can shower the following day of the procedure, but I tell them not to swim or sit in a hot tub or soak the area also for a full week. Procedure is usually pretty simple, easy to do, well tolerated, very effective. As follow-up, we tell the patient to perform at least 50 ejaculations, and then we have them do a semen test. Usually there'll be a follow-up semen test after that to confirm that there's no sperm left in the ejaculate. And once we get that second confirmatory negative semen test, the patient is good to go without having to use any more birth control for himself or his partner. That's the vasectomy procedure in a nutshell. Thanks for watching. See you in the office soon.